Neither the El Paso Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. For over 24 years, the El Paso County Medical Society has brought in our region free medical information by bringing this program to you. You may have heard the words, the El Paso County Medical Society. You've seen the logo. You've heard it over and over and over again, but what exactly does that mean? What is the El Paso County Medical Society? Who is the El Paso County Medical Society? We're going to talk about the doctors that belong, why they belong, and what medical societies around the country and really around the world do for their communities. Again, this show has been brought to you for 24 years through the El Paso County Medical Society, and tonight's one of those nights that we can have that organization and that entity shine. And please do ask questions. That's why we're here. It's a live program. The questions to call us in at 881-0013. We have Madeline Morris with us, and she's been with us quite some time, and she is a second year at the Texas Tech Paulo Foster School of Medicine, and she's great at bringing questions our way. So do ask some questions, because sometimes the people behind the scenes don't ever get their day in the sun. Today we're here to give a day in the sun and maybe the moonlight a little bit, because it's evening and it's romantic and we like that. We're also streaming live on YouTube. If you are not near a TV but somehow are looking at us on Facebook or Instagram, YouTube, you can just search PBS El Paso and you will find us there. And after this program, you can find us at the El Paso County Medical Society website, which is just the acronym EPCMS, also at PBS El Paso. I'm Catherine Berg, and you are watching The El Paso Physician. Thanks again for joining us. Today is a special edition of the El Paso Physician because we usually have topics of medical issues on, but today we're talking about who is it that's behind the scenes of the El Paso Physician. Who are the members of the El Paso County Medical Society? What exactly do they do? It's a big mystery because we've never had this show. So with me this evening, we have veterans that have been with us for years and years, and we have Dr. Joel Hendricks, and he is the treasurer of the El Paso County Medical Society. He's here directly to my right. He's practicing, and he's the chief medical officer of UMC El Paso, but he's also an OBGYN. That's like back in the old days, right? And then we have Dr. Richard McCollum, which you've seen several times here, and he is what he calls the tummy doc, so gastro dude, and he is currently the president of the El Paso County Medical Society. And then we have Dr. Jeffrey Spear, who is the president-elect of the El Paso County Medical Society, and he specializes in urology. So yes, we have very different skill sets here, but we are talking about truly the entity of what the El Paso County Medical Society does. And Dr. McCollum, because you are the current and sitting president, I get to ask you the first question of what in the world are you doing here today? And I'm just going to let you take it from there.
Well, Catherine, you do attract a lot of panelists, and so having you here is a major asset. This was an opportunity for our society to really reach out to the public, the people that we help every day, and just really redefine who we are. We're actively doing this. In actual fact, let me give you some facts. This society was begun in 1898 by 7 physicians, 20 male physicians at the time, and we now have 700 members of our society and 1,500 practicing physicians in El Paso. So what I wanted to do, Catherine, with our colleagues, is to really define for the public and for our listening physicians what it is that we are doing here in El Paso. What are the highlights of this society? What do we bring to the table? How have we increased and improved medical care in the city? And what our future goals are and hopes are for our society.
And
that's in a nutshell.
In a nutshell, and there's a lot that goes on behind the scenes that I think that the general audience doesn't understand. There's legislatively a lot that happens behind the scenes on screenings, on who pays for what What is it that insurances need to cover by law? What is it that counties, that mammograms is one that I think about, right? And you're looking at prostate screenings, and you're looking at all kinds of different screenings. And we're going to talk about PPE. When COVID hit, there was a huge discrepancy on, okay, sure, the hospitals are getting PPE, personal protective equipment, and you're talking about masks, you're talking about everything else. Well, who was going to provide that all of a sudden? And the El Paso County Medical Society stepped in to do that. Who knows about that? Very few people. So we're going to talk a lot about what it is as an entity, as an organization, the El Paso County Medical Society does. And so directly to my right, I have Dr. Joel Hendricks, and again, you're a practicing OBGYN, kind of, but you are Chief Medical Officer of UMC. You've been involved since I can remember. And what is it that you'd like to kind of start off with? I know I kind of threw the monkey wrench at you, like, what are you doing here today? So what are you doing here today, Dr. Joel Hendricks?
I think going back to what Dr. McCallum says, and certainly I think that we want to let individuals know what we're doing. We live in a very unique community, and I think the community itself has such a bond and a trust with their healthcare community. We are one of the highest rated vaccine percentage of a major metropolitan city in El Paso and in Texas. That is a phenomena, I think, is a comment about the relationship between the doctor and the patient. They trust. There is a bond. There's something that goes on, that they believe what's going on. They believe the science whenever the doctor tells them. And I think that's very important. It's something that's unique, not unique, but it's something that we've done over the years. And you know, I can tell you, these gentlemen with me here today, my colleagues, they're very good at it. And I think we're very blessed in our community having had that. It is part of the cement of that is going to be the El Paso County Medical Society, behind the scenes, as you alluded to. And we're fortunate that people do work. They give of themselves away from their practices to be able to do this.
Exactly.
And I think it's a benefit to our community. We partner, everybody partners with, whether it's Border Rack, whether it's a foundation, whether it's the fire chief or emergency. We've all partnered, and that partnership is what makes us the community and being able to provide the care.
I love that you talked about Border Rack, because I think that's something that very few people know about. So, and Dr. Spear, I'm going to throw this your way just because it's your turn next. But what I love to talk about, which we do on the show a lot, is the teaming efforts that we have going on. Yes, there are different hospitals. Technically, hospitals compete, technically. We are in a unique community, as you said, Dr. Hendricks, to where, yes, there's competition, but at the same time, everybody is in it of do the ends justify the means. Everybody's in it to win it together. And I think El Paso is so unique in this way. And you know, we were just talking about, I'm from a land very far away. I'm from Germany, and there are vaccination rates that are nowhere near where they need to be. And here in El Paso, we're looking at America fine, but in El Paso, and just the idea we're being in Texas, but we are leading the nation in so many ways on vaccination rates. Why, Dr. Spear, do you think that is? Kind of going back to the relationships that we have, not only with our audience, but with other medical partners that we have in the community.
Thank you. You know, we've been dealing with a crisis, and when crisis happens, people stand up and come through. And so I want to start with you, because you are a gift to the El Paso County Medical Society. You really are. What you've been doing with this program, letting the general public know what's out there, the physicians that are in this community. So we owe you a debt of gratitude, Catherine. We really do. You are part of the medical society in my mind. So it's people like you, it's people like these gentlemen at the table, and it's people that we're standing on the shoulders of. Our past presidents. I think of Allison Days, I think of Miss Dr. Palafox. I could go on and on. You know, our local community leaders, Dr. Alozi and you know, Okoranza. These are all people that came together to include the hospitals, the administrators, all of these community organizations And I'm proud of the community. We set an example in the state. We visit with other societies around the state. I've been at national meetings. El Paso's an example. And it's to what Joel said, it's the community. Our community is a trusting community. They trust their physicians. They trust what we're telling them, that vaccinations matter. And so I think it's that collaboration in this setting that's put us to the road of success. We have a long way to go. We'll hopefully get into that a little bit tonight about where we are, and that we can't spike the football, like I like to say, because we still have work to do. But I think it's the collaborative effort. I think the hospital systems came together. All of the major hospital systems, I mean, Joel's representing UMC, he can speak to this. Tenet, HCA, all of these different leaders within the hospitals sat down and said, how do we fix it? Because at the end of the day, our healthcare workers deserve a ton of credit.
Oh, no kidding.
From maintenance to the pulmonary techs to the respiratory therapists, everybody deserves credit for what they've done, and they're taxed, and we can get into that too. But there's a lot of tired souls out there. We need to support them, and we need to support each other.
In major agreement with that. And Dr., were you going to say something on that, Dr. McCollum?
Well, Jeff's words speak for themselves. I wanted to give you, Catherine, some perspective for the public. There's 110 medical societies in Texas. We're one of them. And there's 50,000 plus members of the Texas Medical Association. That's the hub there in Austin. And one of our roles and goals is to advocate and improve healthcare, not only in El Paso, but throughout the state. So we go up there to meetings every year. We go to the Hill, we lobby, we present our cases. All physicians do that. And we've made such great gains that are not really appreciated for the public. For example, in the last legislative session, the great extension of Medicaid coverage to postpartum women, so up to 6 months, hoping to get it for a year. Extended care for children or postpartum women already on Medicaid. The 1:1.1 GME ratio. Every medical student in this state is guaranteed a residency in Texas. So physicians stay in Texas for their training and probably in turn will practice within 100 miles of where they last trained.
Exactly.
So that's all schemed, not just spontaneous. It's very carefully worked out. We're going to sustain and maintain the commitment to look after Texas citizens with our physicians that are trained and paid for by the state and your taxpayer money.
Exactly. And there are also private entities, and I'm just going to throw this in really quick. Over the last couple of months, as many of you know, my real job is the Vice President of the El Paso Community Foundation. Yeah. So what we're trying to do too in that medical field is people who do take up residence here, if they decide to set up shop in this region, Juarez, El Paso, Las Cruces, then there is also some kind of relief that is given to some of those medical bills, which are crazy as far as student loans go. But in the idea of this region, and again, I talked about it a little bit before the show started, but several months ago, somebody sent me a link of all these other not El Paso, but all these other community medical foundations and or societies that are airing the El Paso Physician program. So in Milwaukee, there's several. In Arizona, there's several. And so they're taking this program, and we say El Paso all the time, but they're airing it in other communities. So my praise and adoration to the El Paso County Medical Society, because this is being copied and dispersed around the country. If we're looking at 110 in Texas alone, how many of those are being aired? And a lot of it is through, and this is PBS El Paso and or university TV stations that have holes in their programming, and they find programming, what is it that is the most help to their community? And the El Paso Community Medical Society, again, Community Foundation Medical Society, sometimes it goes crazy, but kudos to you, because that is something that doesn't just stay here in El Paso. There is notations around the country of this program and the fact that you've supported it for 24 years. And we were joking earlier, how do I know that I've been doing this 24 years? My daughter was 3 months old and that little rocker thing, right? And I put her in the control room, and we were doing at that time a testicular cancer program,
Dr.
which
Vogelweed,
nobody
right?
want. Yeah, Dr. Vogelweed was on, Dr. Chesbro was on that, Dr. Vogelweed was on that, and oh gosh, the third person's getting Dr. Horowitz was on that show. And to say the word testicular out loud 24 years ago on PBS was just like, what did she say? Are you kidding me?
For the first show?
Totally first show. And so from there, it just kind of evolved. And then you said the words prostate, and then you said the words breast, and it's like, oh my God, are they saying that out loud? And that's how long this show's been going. And a major thank you to the El Paso County Medical Society for doing that. On that note, I'm going to stop for a minute, and Dr. Hendricks, you were talking about earlier the idea of everybody coming together. And Dr. Spear, you were talking about, you know, all the different medical professions, but even as I got my booster shot on Friday, the guy that's sitting there and he's writing all my information on a piece of paper, he doesn't have to be there, right? He kind of chooses to be there. There are some choices, it's a job, it's not a job. But I'd love for you to talk a little bit about the County Medical Society and when COVID hit, now all of a sudden, everyone in the world needs a mask. All of a sudden, everyone needs gloves. All of a sudden, everybody needs some kind of protective device when they're seeing patients. And I'm just opening this to all three of you. I'm just starting with you. How did the El Paso County Medical Society jump in entities that are maybe doctor's offices or clinics or places that the hospital systems weren't able to provide all this PPE? Now there's all these systems that need PPE. And that's such a big thing that I don't think people have a clue about behind the scenes. And again, I'm starting with you, but I'd love for the two of you to jump in.
So I think that certainly it caught everybody by surprise, obviously. And when everything started to shut down, it's a matter of how are patients being able to go to their doctor's offices? And you're correct, PPE was in short supply. It was in short supply for not only doctor's offices, for hospitals, for everybody, because it had been sequestered or whatever. The El Paso County Medical Society very quickly was able to reach out to for example, Border Rack. Border Rack had some stockpiles.
Right.
We had individuals who went out and bought it on their own, and they brought it in to the Turner House, and it was stocked there. We had the Texas Tech medical students weekly. They would help distribute that to the physicians' offices so that they would be able to continue to see their patients. The hospital systems had more conduits for finding the PPE. Small offices didn't. And that's where the El Paso County Medical Society, Patsy Slaughter, she was very good at making sure that these things were happening. Allison Days was president at that time. I don't know if she really realized what was going to happen whenever she became president.
I don't think anybody did, right.
And you know, what a remarkable leadership of what, to be able to be so resilient in this time, whenever it's life and death, the information exchange, not only PPE, but people didn't know. It was changing all the time. And you know, you, you didn't want to hear about it on the news. You wanted to hear it from reliable sources. And I just am very impressed with how people came together. Like I said, the staff of El Paso County Medical Society worked tirelessly for that.
We just learned, you know, that most medical societies have a lot larger staff than that. So these are two women who absolutely deserve a ton of credit. Our president at the time, Dr. Days, was remarkable, but it takes a team. It was a team effort. Everyone did their part. You know, I remember, you know, March of 2020, I was on spring break. I stayed in town, and I got a panic call from the office. You know, we have 200 staff, you know, at Rio Grande Urology, and things were disintegrating as we spoke. I mean, it was just happening minute by minute. There was panic. And everyone has to remember that the physicians also have families. You know, my wife and daughter were worried. Everybody was worried, and we'll never forget it. It was, you know, I don't want to compare it to anything, but you know, you remember certain times in your life. This was one of them.
Right.
And trying to keep the morale up, you know, trying to make everyone feel safe, in large part was done by organizations like the Medical Society, but it's leadership and it's setting examples. It was a tenuous time.
It really
a
was.
and I think we all will remember, and your audience will remember where they were when all of this started to take off. I remember the first case when it was announced here, and I was one of those that thought, oh, you know what, this is gonna, it's just the, it's the flu. We're gonna be fine.
Right.
Fast forward, no one expected where we would be today.
So I remember the first show that we did was What's Happening Now, and it was March 23rd. Not one case had been reported yet in El Paso. And we had Dr. Ocaranza on one side, we had Dr. Elosi on the other side, and we had Dr., oh, don't get mad at me, the other guy that had, just like you, Dr. McCollum, everything spread out here. And he said to me, is it okay if I have my notes here? I'm like, by all means, because he literally, as we were going through the setup, the 20 minutes prior to the show was getting updates on what was happening. Yeah. And so the El Paso County Medical Society, praise and adoration to you. And as we're talking about, my angel is Elsa Shapiro. Elsa, if you're watching, Elsa's like, hey, you remember we have a show? You're in Germany, fine, but do you have, so gathering all the information, putting it together, it matters. It so matters. And the day that we had that show, I think it was a week and a half before we had our first case in El Paso. But we were reporting about what was going on really around the world. A couple of cases at this point have kind of broken through in America, but just being on it. The El Paso County Medical Society was on it. And we're talking about teaming. We're talking about county and city and hospital systems and people coming on this show, which again, should be competitive in all the other worlds, but no, we're all in it together. And I know people are like, we're in it together. They don't like that anymore, and I respect it. But when we're looking at dissemination of information, and Dr. Spear, you have in front of you, and I don't know exactly where it is, but there is the El Paso Physician magazine, if you can throw that my way, but also this periodical, this one. So I just want to show this here. So this is something that goes out to the public, and I know you probably can't see it, and I respect it, but it's information, and Dr. Hendricks, you were talking to me about this. This goes out to the medical society or docs in general. And I'm just going to go through really quickly some of the information that's on here. Obviously, the positive cases, how many are hospitalized. The big question is how many patients are in ICU, how many are on ventilators, because that again is a supply issue. Do we have enough beds? Do we have enough ventilators, et cetera? This is going out every 2 weeks, vastly different in different weeks and different months of the last almost 24 months now. It's kind of crazy. We're looking at an average positivity rate. Right now we're at 2.73. But again, think about how crazy that has changed over the years, or over the months, I should say. But there's also on here legislative news, which is a big deal. Again, I want to stress that because I think so many of us take for granted the fact that mammograms, for the amount of money that they could be, the amount of money that they actually cost. And this is all done, it's different in different countries, I respect it. But without the El Paso County Medical Society and the members and people who are in the leadership going to Austin, sometimes going to Washington, D.C., who would like to take that on? Because I'd love for that to be expanded on a bit. And I know that you're current president. I would love to address what it is that you do in Austin as a medical society.
I have to commend our representatives, both the Senate and the House, that they took time out of their busy legislative schedule to listen to us. And there were certain bills and certain things that we thought that would affect the care of our patients and the ability to take care of them. And they gave us time. And for that, I want to say thank you, because they didn't have to. And obviously it was by Zoom because of all the COVID going on. And they were spending 18 hours in the Capitol at a time trying to get these things done. And but they would sit there and listen to us. They would be on the House steps on the stairwell, talking to us and listening to our opinions. And I really appreciate that. And that's what the El Paso County Medical Society was able to do, was able to get together and able to have at least express our views on certain bills. Some of them we didn't think would be very beneficial for our patients and or our ability to take care of.
And I'll add for your audience the big picture. Right. Because if your audience is sitting there, they're saying, okay, what does this all mean? And I think of, for example, two physicians that come to mind. There's a ton, but Dr. Louis Urea and Roxanne Tyrock, I mean, they're involved with the Texas Medical Association. They're in Austin. And what does this mean for your audience and the patients? Well, physicians are notoriously stuck in their clinic working all day. There's not a whole lot of time for health policy issues and for advocacy, because we're so in tune with our own practice. There's other organizations, the attorneys and God bless them, but they are in Austin, they're in Washington, and they have very strong lobbying. So we've just, it takes a lot of effort to educate our physicians about the importance of us being able to sit at the table in Austin, because this community is better served when physicians are engaged. And so that's a big part of what we are trying to accomplish with the Medical Society, is to educate our physicians that don't just think of your own practice. Think of the house of medicine. It's very important, because we're nothing without advocacy and health policy.
So, and you're looking at that, and you're looking at research too. Everyone benefits from good research. And so sometimes you're looking at your own practice, your own hospital, et cetera. When there is the bigger body doing research on the other side, everybody benefits from this. And I think part of this program too is, we were talking about every 2 or 3 years, if we're doing a show on any kind of cancer, I just feel like oncology, genetics, what is changing literally monthly to monthly to monthly basis on that. So when you're looking at the bigger picture, advocacy and governmental issue, and again, the way I'm seeing is that how is the audience benefiting from what you're doing? And if I can make that the most direct way, and even though money is icky, money matters, right? It's icky to talk about money, it's icky to talk about insurance, it's icky to talk about a surgery is going to cost this much versus I'm just not going to do it. When you're looking at the world of advocacy, it's how the entire main population has access to medical care and screening. And that, for me, the way the audience might want to hear that is, how do we have access to medical care? In El Paso, we have a little bit more than 50% of the average amount of doctors that other cities in the United States have. This is one of the reasons too that we're putting together what we call the Physicians Relief Fund, right? It's a way of, how do we get doctors that come to El Paso, how do we keep the doctors that are here? And Dr. McCollum, you had a great point on that earlier. How do we keep the doctors that are practicing here now or having their residencies here? How do we keep them here? And I think a lot of it is like Madeline Morris that's there answering the phones to us. Thanks again, Madeline. So she is, again, her second year of medical school. And Madeline, you better answer right now and say it good and loud. Where are you going to set up practice? Texas and El Paso region, right? Yeah. So the idea is too, I mean, when we're looking at that, it just, how do we make the greater good?
Well,
Dr.
one of the things
Yes.
we do in the Paso County, we support our medical students very much in the world of the free clinic. I run a free clinic every Saturday morning with our first and second year medical students. I see in person the compassion, the commitment they have to the underserved and underprivileged of the city. And that's when they start. That's when they see the need. It's superimposed on the Hippocratic Oath. That's what their future means to them. And they're embedded in primary care, and particularly the Hispanic component of that, and the opportunity to be bilingual. And the El Paso County Medical Society highly endorses and supports those medical students.
So if you can talk briefly about, it's the Rotocare Clinic and the Sparks Clinic, is that correct?
The Sparks Clinic is
Okay.
another clinic of medical students, and then there's the Baptist Clinic, which is
That's
the
right, the
oldest
Baptist
clinic,
Clinic, okay.
which also has medical student representatives.
So we never talk about this. Sorry, I just popped the mic. But we never talk about these clinics. So these clinics are free to the public, 100%. People line up. They open up at 8 o'clock. People are lining up from 4 o'clock going on. There is a doctor in charge. There are medical students there. If you could just give a little bit of information, because that is like, that's the bleeding heart in me that wants people to know what's happening in these free clinics.
Well, we meet typically the Rotocare Free Clinic, which is sponsored by, supported by Rotocare, Rotary Club of El Paso, downtown Rotary Club. We meet every Saturday from 9 to 1 o'clock, and we see about 15 to 20 patients. And these patients, no money is exchanged at all. We have a medical record of them, and we're treating hypertension, we're treating blood pressure, we're trying to prevent strokes and heart attacks, but we're also looking after miscellaneous items from orthopedics to dermatology to gastroenterology to cardiology, and all those colleagues come and have a consultancy day. We do pap smears and pelvics. And we also have a social worker. And the social worker can direct our less fortunate folks back into the mainstream. And particularly preventive medicine, how to get your mammogram, how to get your colonoscopy. We focus on that. So we try, and we have a lab. We run all the blood tests that morning. So we try to give people who have no way of accessing that kind of quality of care.
Exactly.
We try to give it to them at least for 4 hours every Saturday morning, and I get them back into mainstream medicine. And our students see the example, see their attendings down there volunteering, and we watch our students understand the true compassion of medicine and what it means to be a physician.
You know, I'd love to do a show one day that just has the students on that either we've had on this program or just the clinic. And I think that next time we have that opportunity, I remember years ago we did a program on the willed body program, and I thought to myself, what in the world am I going to talk about for an entire hour on people willing their bodies to science? And we had a medical student on who humanized the entire process beautifully, because he will not call the person on the table a cadaver. He says, that's not a word we use. This is Jeffrey Spears' grandfather. And we go through everything that Jeffrey Spears' grandfather did for a living. Was he in an asbestos factory? Did he work here? Did he work there? What's his family life, this and that and the other, so that you identify the person, what their lifestyle was, which matters immensely when you're looking at this person's death, however it occurred. And so this is where students come in, and I'm just saying that as a personal desire. I would love to have a program with just students.
Well, let me tell
Dr.
you,
Spear?
we are in very good hands with the students that are coming in and applying to medical school. They are outstanding. It's getting harder and harder to get into medical school. And so, I mean, it's just impressive listening to them. I've been fortunate enough to interview a few. And so they are going to play the most important part in our lives, and it's important to get them involved early on. So this, I mean, we'll support that idea 100%.
I'm in complete agreement with you. I want to, and when I talk about this magazine, we're kind of, believe it or not, the show's starting to wind down. I want to talk a little bit about this publication right here. And this is a publication, it's the El Paso Physician publication, so it's the print version of the show, so to speak. And who of the three of you should I ask about the importance of this publication? It's important for research, yes, but peer-reviewed studies, which is such a big deal, which again, you don't want to go to Dr. Google, you don't want to go to just anywhere on the internet, you want to find studies that are peer-reviewed, studies like this. Dr. McCall, I'm gonna go to you first as president, but I would love for you guys to talk about this publication, what it
It's a
means.
number of roles. One main role is to elevate medical education in El Paso by presenting to them true cases, case series, true research and observations. And to, at the same time, but what's very important about the journal is an opportunity for physicians in El Paso to publish their article and say, look, we have this new technique in El Paso. You don't have to leave. We have all this stuff going on right here, the best consultants, the best technology, and the highest medical care. So by publishing case reports and evidence of patients doing well and getting special techniques, not just at Texas Tech at the university UMC level, but we tend to attract the highest and best technology. But everywhere it's being absorbed and patients can benefit from it. So this can be a journal, it is a journal, which promotes individuals as well and allows them to say, gee, I'm here making a difference in El Paso. Please come and see me. I can take care of you. And some of that reputation sometimes has been lost. A lot of my patients say, gee, do I need to leave El Paso, Dr. McCallum, go to that Mayo Clinic in Scottsdale and do other things? Certainly MD Anderson will always play a role. But no, we have the best here as well. And we promote that through the journal. And we give examples of cases and outcomes that demonstrate that.
And I love the way you say that. I'm just going to repeat what you said, because cases that are happening locally, they may be happening in other parts of America or other parts of the world, that's fine. But we have local physicians and we have research that's published in here. And Dr. Hendricks, I think you talked with me a little bit about this prior to the show starting, but I would love to have your input on how important these kind of publications are in the world of medicine. I mean, for the general public, I don't know how many of the general public even know this exists, but these go to all the members of the El Paso County Medical Society and others as well, and how important and what is the importance of this nationally and sometimes even internationally?
So I think Dr. McCollum hit the nail on the head. When we talk about within our community, and we talk about what are other doctors doing, this is not a specific hospital system. This is not, you know, it's not them against us, or we're going to one-up you here at this hospital versus another. This allows all the doctors to sit there and say, hey, this is what we're doing in El Paso. And I think his important point was that, do you have to leave?
Right.
So it is important for individuals to understand what's available. It's so much better to get your care locally, and we're getting better at it. We're getting more specialists. We're getting more service lines. We are doing better so that people don't have to leave.
Right.
You're closer to your family. You're able to help and support them. All these things are so beneficial. This magazine certainly does help inform doctors, as Dr. Spear said. Doctors are busy. They're busy, and if they can come to a source and say, oh, I didn't know we had that, and then be able to utilize that with their patients, that helps the community.
And when you said source, that in and of itself, especially in this day and age of you can find information anywhere, often it's not real and or good information. So when you say source, and we talk about this on the program quite a bit, when people leave today, please go to pbselpaso.org, find the show, and or go to the El Paso County Medical Society's website, which is EPCMS, find the show. But the important thing is when you're going to a website, try to find something that has ORG at the end instead of COM. When you have an ORG behind it, it's a small thing, but it's at least a way to start. And make sure that the studies that you are viewing and looking at are peer-reviewed. And when I say peer-reviewed, peers of doctors, meaning the colleagues of doctors, look at it, put their eyeballs on it, approve it, and now it becomes a record that somebody can say in their college dissertation, you know what, I got this information from the El Paso Physician Magazine, volume 44, number 2, boom, it's on there. It matters because there's so much information out there. We are kind of at the 18-minute mark, and I would like very much to stop talking from my end, and Dr. Spear, if you don't mind, start with you, Dr. McCollum, and then Dr. Hendricks. If we can talk about what you wanted to make sure the audience knew about regarding the El Paso County Medical Society, and then we'll pick it up once we're done with that. So, Dr. Spear.
Well, you know, I think a lot has been said about the medical society. It speaks for themselves. It speaks for itself. I think that we're trying very hard. This is on our own time. You know, these are not paid positions. We're doing this because we believe in what the medical society can accomplish. It takes a team, and so we're trying very hard to educate our physicians. We have now webinars that are virtual. The virtual platform has been remarkable for that. It's been incredible to include, you know, we've had a ton of meetings within our own medical society, but as far as the education piece, we've really started with Richard's lead, some educational webinars with CME credit for our physicians, where they can gain CME. It's been wonderful. I mean, we've had Jacob Centrone and Nico Tejeda on about the hospitals and how they're getting together. We've just had a multiple, how to navigate through this landscape, whether that be in private practice, hospital, employment, or private equity. We've had a bunch of educational sessions, but what I want to hit home for the audience, because if they're still here listening, is that we're seeing a ton of delayed diagnoses. A ton of delayed diagnoses, and it's worrisome. Patients are starting to now come into the office a year and a half later, and in my specialty in urology, I think I can specifically speak to prostate cancer screening, and thank you for having a monthly meeting with some of my colleagues. PSA is a screening tool. I just had a gentleman walk into my office, and it should be between, you know, the number really is 4.0 and lower to keep it simple. He came in with a PSA of 9,500. And he got out of his chair and he broke his leg because he had a metastatic lesion, a lesion where the cancer had spread to his femur. And this is part of our responsibility as physicians to educate your audience and say, don't delay, get in. It's, we make it as safe as we can. We're taking care of all of the protocols within our office. It's a concern, and I'm sure it's happening in GI and OB-GYN, OB-GYN. And so it's important that I talk about that, and then we could also, I don't know how much time we have, but telemedicine is another topic that I wish we had time to discuss, because I think it's here to stay. I hope it is, especially in our community with serving communities like, West Texas and Van Horn and Southern New Mexico and Silver City, where these patients have really benefited from that system. We hope it stays. But that's some of the bright lights that we're seeing through this pandemic and this crisis. We're seeing a lot of things that came out of it. The virtual meetings and to be able to talk to your patients from afar has been just remarkable.
I'm in total agreement. In fact, when we first started doing the show again, I kept looking at the screens. I kept thinking we're on Zoom. Telemed, I do want both of you to touch base on that too, as well as Dr. Spear just talked about. So telemedicine is part of my other job again, broadband, right? We have, and it's little by little getting better, but one of the places at the El Paso Community Foundation and others involved, we're trying to get broadband to areas and neighborhoods that do not automatically have, meaning how can I get access to the internet unless I'm at the library? If I'm sheltered at home, how do I get to a place where I can get on the internet, or a place that I can actually have a meeting with my doctor on the phone? So that's in and of itself on the side. Dr. McCollum,
let me build on what Jeff said.
Yes.
Jeff will be doing some of this to be a great next president. But in our attempt to educate our physicians, we're taking on very important topics. Burnout, physician burnout, just like every other burnout, is a huge part of our challenge of our profession. Opioid abuse, all these things we're bringing to the public through our physicians through CME accredited programs, making a huge difference. And we're partnering with people in the city, particularly Emma Schwartz at the Medical Center of the Americas. We're evolving the opportunity to do clinical research in El Paso. We're going to improve the commercialism of El Paso. Companies come here with the latest and greatest drugs. They want to do clinical trials. We're going to enhance and make that possible, just like she's working on trying to help equipment and commercialization of pacemakers in particular. Build them in Juarez, sell them in the United States. So we're a partner with people who are making a difference in the city and trying to continue to evolve it. And education and elevating the game and bringing the latest and best care through some research opportunities to the public, to our patients. That's a big difference.
Agreed. And Dr. Hendricks, on your end, and maybe going back a little bit as an OB-GYN, and you're looking at women who are pregnant, fine, but then there's all kinds of other issues as well. And telemedicine, just bringing back to the day, just having a conversation, the clinical, as one would say, I observe because I'm answering or getting questions answered from my patients. So when you're looking at telemedicine, where do you see that happening in the future? And Dr. Spear hit very beautifully on this, because it's something that we had to do with COVID, realize that there's really a great efficiency with it. And how do you see that going on into the future?
So, for example, during the pandemic, everything shut down, and it was difficult to get into clinics, get into offices, and as we've talked about. And so in our neighborhood health clinics, we were up to 50% of telemedicine visits at one point. Then as it relaxed a little bit, we were able to get people back into it. One of the ways that was being done is certainly on medicine type of refills, those type of things, that worked really well. There's still need for in-person visits, and I personally like in-person visits only because I like to look at the person in the eye and talk to them. I mean, I think that's real important. But say, for example, in an OB visit, there are certain times when you're able to do things on the line where you're able to make sure that the patient's doing okay. And that's a touch point. So you want to have that touch point with your patients and be able to record that so that as you may need the next visit to be in person, but that one didn't have to happen. Whether that's OB, whether that's a chronic disease, whether it's a lesser problem that they may have. Those are touch points that are very important. And to Jeff's comment, yes, I think it will, and I think they will start from the medical, from the law, they will allow that from CMS. So those are good things, and we'll have to see how that works and to see where that falls into the basic care of medicine.
And Dr. Spear, I'd love for you to highlight again, you were talking specifically about an individual that had a PSA that was, I've never heard of a PSI over 9,000. So let's look at that with all disciplines. So there are people who are having cardiology problems thinking, oh, well, I don't want to go to the hospital right now. I don't want to go to the emergency room because, you know, we're starting to see another like minor spike, if not major spike, depending on where you are. If you could talk about, again, for the audience, if there's something that they're struggling with, but they're scared to go to the ER, maybe talk about how hospitals, and again, we're looking at it all around, there is screening at every single hospital, every single doctor's office of people of, have you been exposed? Is this, exists, is this? So let's talk about the person who's sitting at home thinking, I've been having these chest pains, I should be going to the doctor, but I'm not going to because of COVID. And I'd love for all three of you to chime in on that, but since we started there, let's talk about that a little
Thank
bit.
you. I think the word is complacency. I think what happens is, and it's just human nature, that you feel good. Okay, I missed my appointment. Well, I missed my appointment, but I still feel fine. Next thing you know, it's 3 months later and 6 months later and COVID and excuses and I don't want to be exposed and I'm worried.
Right.
I think it's incumbent upon physicians, the hospital systems, to figure out a way to educate our patients. This is one way to say, you can't sit at home. You got to get out and you got to go see your physician. Because there are symptoms that are hidden, that patients don't really, that don't have, but there could be an underlying problem that's going on. I mean, I have cardiac issues, it kind of was silent. There are things that need to be addressed even though you're not feeling it. So I think what it comes down to is a bit of fear, and then it becomes habitual.
Right.
Then the next thing you know, it's a year later and you haven't seen your physician in a year and a half. So these types of programs are critical to educate the public and say, get off your rump and get to the doctor.
Let me just add something.
Absolutely. Talk about
I'd be remiss
prevention.
not doing that because you talked about it at the beginning, the 25% of people who are still not vaccinated and are still making it difficult for people to have faith and confidence in venturing out and going to hospitals. I meet them every day in my clinic. I spend 10 minutes trying to twist arms and make my case. Let me just make my case again now. Please, anyone in the audience who's not been vaccinated, there's no way you can rationalize this. Please do the right thing for your family, for the city, and for all of us, so we can try to overcome this terrible dilemma. It's safer to get a COVID vaccination than you driving home tonight and having an accident. It won't happen. COVID's so rare as far as side effects. Please, take our advice. We are the leaders in the city. Get vaccinated.
And if it helps any, if you've ever been to the Civic Center, they are open every day from noon till 4 for sure. El Paso Strong, if you go to epstrong.org, they will give you sites of where you can get the COVID vaccine for free. And those of you that have your 2 doses, if you're 6 months out of your last dose, you are eligible to get another dose. Again, this is where El Paso is really, I don't want to cuss, but we're kicking butt and taking names on this.
Yep.
So we have the people in force, we have the county, we have the city, we have the medical systems all in place that are doing this. I got mine on Friday, and just to let you know, tiny bit of a headache, done. It matters. So I know we're not here to tell you what to do, but all 4 of us will say, if you get COVID and you've had both your vaccines and or a booster, it's not going to prevent you necessarily from getting it. Your chances are a lot less, but it will prevent hospitalization and death without question. And that's the science. And we were Dr. Hendricks, go to town, because you were talking about this right before we got on the air. If people would listen to the science and not to what their predisposition is, I'm just going to ask you to take it from there for just a second, please.
Well, certainly medicine is based on science, and that's how we operate. We use science in order to be able to treat people. And I think that's where that partnership between the patient and the doctor is so important. So if the science, and we listen, we read our journals, we listen to our colleagues about how to work, and with that, we're able to try to give the advice. And so certainly we understand the risk and benefits, and the benefits are so much greater than the risk. We've all gotten our vaccines, we've gotten our boosters, and we have so many individuals in our hospital right now who are very sick, who wouldn't necessarily need to be that sick if they had gotten the vaccine. The pandemic is not over. People have to understand that. It's not over yet. And we're in this mini surge right now, and people should be aware of that.
Agreed, and I respect that we're a medical show. We are a medical program called the El Paso Physician. I get it, but this is so not a political issue. We've talked about politics a little bit today because we are talking about what we're doing on the legislative level to help people live in every way, shape, or form. Dr. McCollum, as the current sitting president of the El Paso County Medical Society, what are some of the conversations that you're having in some of your meetings throughout this last year regarding what audience members are asking? Like, what are some of the questions that people on the street that know, oh, you're that doctor Dr. McCollum guy, what are they asking you?
Besides the COVID situation?
Well, COVID, but how,
I
I'm
think,
not feeling so good,
well,
my
I
stomach's
think,
irritated. Do I go in? Do I come see you? What do I do?
I think it's a lot what Joel talked about. It's the trust and the faith they have in physicians by the way we behave and act, our professionalism, what we've done, gone to work every day. I haven't missed a day at work. Sustained and maintained our commitment. They see that. They understand that. They trust us. And they know that if we say to them, it's fine to come in and see you. Yeah, we can do some telemedicine. Eventually I'm going to see you. But please do the first thing first. Let's all get vaccinated and be on the same team and have a life and a future for our families and our children. And so I think they've reapproached me to make sure I can tell them that, yes, we're committed. We have the faith. We are moving forward. You've seen us in action. Trust us and continue to trust us again. We and members of the El Paso County Medical Society, who are the leaders in the city. That's the message I've given them.
Nice. And again, we're talking about the different hospital systems. We have, I don't even want to name them all because it's not about that. I want to talk very much, and a huge thank you to the El Paso County Medical Society, because this is a show that everyone in the medical society, we have 700 plus members, I understand, have contributed to this program. This program is all about educating what the El Paso County Medical Society is, what it stands for, how is it that everyone in this region benefits, and how does the Texas Medical Association, the America Medical Association, and globally, there are organizations like this that are trying to get information to the general public. And that's what this show's about. This show's about, first and foremost, preventing situations that don't need to happen. So when we're talking about Dr. Spear, when you said people are delaying their care because of there's fear, I don't know if I should go. It's all about prevention. If you get in there and get something diagnosed early, we can get things done and save the day. I want to say a huge thank you to Dr. Madeline, look at that, Madeline Morris. You will be a doctor.
2 years.
Yeah, 2 more years, Levy. And then once you set your residency put together, we've got about a minute left, so I feel like it's not enough time to ask a question, but Dr. McCollum, go.
I just want to thank you, Catherine, for giving us the opportunity. It's the first time, I think, the El Paso County, so being before the public and explain what we do. It's a great honor to do this with the first future president, Jeff Spears, and with Dr. Hendricks, who is not the CEO yet, but he's still the chief medical officer. But I want to say also, for a quarter of a century, someone's carried this society, maintained it and sustained it so that people like me and Jeff Spears can be the beneficiaries of presidency. So I want to thank personally Patsy Slaughter and her associate, Elsa Shapiro, for the behind the scenes. They have put us on their back and sustained us with many long hours. A personal thank you on behalf of all of us.
Excellent. So we're getting countdown. There's a whopping 7 seconds to go. You guys get to watch us behind the scenes. So now I say thank you for watching the El Paso Physician. I'm Catherine Berg. Good evening.